Homeless advocate Eric Jonathan Sheptuck coming at you from Northwest Washington, D.C., right outside the 441 4th Street building. This is a D.C. government building, and behind me you may see two flags flying at half staff. I'm not sure if it's because of the coronavirus pandemic or for some other reason, but I do have some bad news to bring to you today concerning DC's homeless community and the COVID-19 pandemic. I have learned that within the past few days, at least 5 homeless people in Washington, D.C. have died from COVID-19. And in D.C. as a whole, as many as 88 people have died from COVID-19. And what's interesting here is that the homeless are about 1% of DC's population, but we're more than 5% of the COVID-19 deaths. So a disproportionate number of those in DC dying from COVID-19 are actually homeless people. In addition to that sad note, I should say that I learned that at least 88 homeless people in Washington, D.C. have coronavirus, and at least 32 of them have come from the CCNV shelter. The data collection has lagged behind a little bit, but we've done some catching up, and those are the numbers now. So 32 people at the CCNV shelter have tested positive for COVID-19. And that is definitely the lion's share of the cases within the homeless community. The other 56 are spread between, I don't know how many shelters, but definitely at least 5 other shelters. But that said, let me see. Well, the bad news continues. You see, a number of advocates here in DC have been pushing for affordable housing and an end to homelessness for many years. And city officials across multiple administrations have played a lot of games. Homeless service providers are not really incentivized to end homelessness because they work themselves out of a job. We've known that for a long time, and I could go down a long list of things that point toward them really not being incentivized to end homelessness, not really wanting to end homelessness. But with COVID-19, people are really concerned. I read an article this morning in which I'm quoted, and in that article, it pointed out that people are now concerned that the homeless might infect the housed community. The homeless people do come in contact with housed people, and now housed people are worried about being infected, and that goes right back to the games that different administrations have played when it comes to affordable housing, ending homelessness, and the like. Let's throw in living wage jobs, but they didn't decrease homelessness as much as they could have in past years, and now they fear that the homeless community will infect the housed community. You would hope that they'd have a genuine concern for all people, homeless and housed, and that concern would translate into homeless people becoming housed people. You would hope that the concern for the homeless isn't a secondary concern, secondary in the sense that the housed people are only concerned about the homeless now because the homeless might infect the housed. I should also add in here that with DC having become a ghost town because of the lockdown, the homeless stand out more.
You gonna give me $10?
So let me finish. But that said, things are a bit grim. I should say on a more positive note that things are still rather quiet at the CCNV shelter. I have a sneaky suspicion that those cases that I told you about did not occur within the last couple of days. I've seen the protocols they use when someone tests positive, or not, I shouldn't say test positive, but when someone thinks they have coronavirus. The protocols include taking the possibly infected person, sitting them in the breezeway between the two sets of doors at the entrance, cordoning off the breezeway so that no one else can use it, having other people use the alternative entrance on the wheelchair ramp, and then after the person is taken in a medical transport, then a cleaning crew comes through and disinfects the breezeway. And that's what they've been doing whenever someone thinks they're positive. I haven't seen that happen in almost a week now. So I think that the 32 cases, that it's just a matter of the data time lag, and the data has finally caught up. But things are rather quiet at the shelter. As a matter of fact, so quiet it's a little uncanny. That shelter has about 1,000 bed capacity, but I don't think that even half of those beds are full. That's just my sneaky suspicion. I've noticed a decreased level of activity in and around the shelter in the past couple of months, even before the lockdown. And I'm under the impression that city officials who want that property for new development quite possibly told the shelter administration, don't accept any new intakes. We want to wind down the population of that shelter and redevelop that property. Now, I'm not saying that for a fact. That's just my sneaky suspicion because of me having dealt with these types for so many years now. But in any instance, that's the quick and dirty, and hopefully we won't have any more homeless people or housed people die from COVID-19 in Washington, D.C. or anywhere. That's not reality, I guess, but one can only hope. So I'll leave it there.